So, hi everyone. Welcome back to the See Big Screen snapshots, where we talk to different partners of the See Big Screen project. We're very excited today because we have Rosa Legood with us here from London School of Hygiene and Tropical Medicine. Rosa is Associate Professor of Health Economics in the Health Services Research Department at the London School of Hygiene and Tropical Medicine. So this is a slight departure for us. I suppose so far we've talked a lot about the cubs and the vulnerable women that are involved in the project. So this is a little bit of a different angle, which we're really pleased to be able to include in the snapshots. Also because this is Cervical Cancer Awareness Month this month, it's great to to see the issues and put them into context in from the many different aspects that are relevant. So, Rosa, thanks so much for agreeing to be here and to talk to us. Do you just want to tell me a little bit about, what exactly the health economics angle is and what you've been doing so far in See Big Screen?
Yeah, sure. So I'm the work package leader for the health economics and modelling. And what we're looking at is it good value for money to do cervical cancer screening for vulnerable women and the methods of implementing that. We've been doing like a systematic review to look at the literature that's already out there about cost effectiveness modelling. And there's a couple of options that look good in terms of cost effectiveness, and that's self-sampling and letters to the patients.
Okay, and are there any ones that have kind of specifically stood out in terms, I suppose, because there are the different intervention countries in the project? Is there anything that has stood out in terms of what may or may not work in different countries, or just even in general?
I think kind of what's interesting is that the studies that are being done are mostly on women that haven't been screened before or have low uptake, but they're not specifically about vulnerable women of a specific nature or a specific group. They're more general of people in the general population that haven't attended screening. So there's definitely a big gap in the literature in our knowledge about vulnerable women and the best methods to increase uptake in those specific groups.
Okay, that's really interesting. So a huge gap there, really, then.
Yeah, that's right.
Okay, and can you tell me a little bit just about how you did the systematic review for maybe for some people who aren't totally familiar with how it's carried out?
Oh, so we searched a number of databases and double screened the databases and found 18 studies that were relevant, and then we extracted the data from those studies to find out their findings.
Okay, great. And were they mainly done, I suppose, in a kind of a
Across
European
Europe.
setting, or?
Yeah, we were just looking in Europe, so they were all across Europe. The studies have been done before.
Okay, that's great. And did you notice, so we had, for example, Irina Todorova from our Bulgarian partners, the Health Psychology Centre, who spoke, really kind of strongly about, the differences in screening uptake, between, say, Bulgaria then and, a lot of Western European countries. Obviously, there's a huge discrepancy. Did you find anything like that in the literature? Was that a bit of a gap as well?
We weren't looking specifically at that issue, like where the screening uptakes are different in the different countries. We were more because all the studies we were looking at were where people hadn't been attending screening, so there was that problem across Europe.
Grand. Okay. Yeah. And in terms then of like See Big Screen going forward, what's the role of health economics within the project, and what do you kind of hope to attain, I guess?
I suppose we'll be looking at the value for money for the pilots that we're implementing in the 3 countries in Romania, Estonia and Portugal, where we'll be doing implementation pilots, and we'll be doing costing alongside the pilots to see how the value for money of those that element of the pilots.
Okay, and what's the rough timeline for those pilots? Do you have one yet? Or?
The pilots will be at the moment. There's a baseline survey going ahead, and then next year it will be the pilots will start.
Okay, great. So we might ask you back to hear a little bit more about the pilots, because it's fascinating to I suppose to see the evidence grow or develop in real time. Is there anything else you want to add about just about the work in general about the project?
Not that I can think of.
That's okay. That's great. Well, listen, it's great, just like I said, to have the just the different aspects, and I suppose to have that the economics of an intervention is really important, because if it is to actually be a lasting intervention, it's really important to have all angles tested. Rosa Legood, thank you so much for being with us, and hopefully, like I said, we'll have you back, and we can find out more about the interventions and how they're going, and maybe even before they start, we might see how how the plan has been developing and everything. But so for now, Rosa Legood, Associate Professor in London School of Hygiene and Tropical Medicine. Thank you so much.
Thank you.